So, ma'am, is there a relationship between the infantile colic and continuous cry of the baby?
Unconsolable, excessive cry in an otherwise healthy individual. Parents come to you with so anxious mind, anxiety, worried that my child is feeding well thriving, gaining weight, everything. But once in a blue moon, child start crying and cries like anything.
For example, a child is diagnosed with NEC, but as it is commonly said, the first few years of your life will decide your rest of the life.
Keeping this in mind, we should make the diagnosis because keeping the child lactose free is like a daunting task for the parents. It's not that easy that I'll say keep the child lactose free and parents will be so happy to do that. Keep this thing in mind that if it could be your child, how would you manage a child, keeping the child on lactose free or the bovine free things?
Hello and welcome to all our viewers for yet another enlightening session talking about the infantile colic or the gut health of the children who are infants and newborns. So, which is called as infantile colic, maybe NEC, necrotizing enterocolitis, and a few more issues regarding the same. And to talk about this very specific and a niche topic, very important topic for the patient who are suffering from this and their families as well, we have Dr. Anubhuti Bharadwaj, and she's a pediatric gastroenterologist at Hope Hospital in Jaipur. Ma'am, I welcome you for this particular topic to discuss.
Thank you so much.
And before we go into the details of the conditions and the disorders and disease, I would like to know from you about your journey and what drive you to get into the pediatric gastroenterology specifically.
Thank you so much. It is my proud privilege to be here today. Being a pediatrician was always been a calling for me. Though belonging from a medical background, my parents were doctor. So I always dreamed of being a doctor for my career. So I chose to be there in pediatrics. Then after doing pediatrics, I was like in a dilemma, what to choose and what not to choose. Should I go for the surgical branches, the non-surgical branches, or the clinical ones and the non-clinical ones? Then I myself did a scrutiny. So whether I want myself to be on tip and toes 24/7 as an emergency doctor, or should I not? Then I scrutiny for the second time, the best field for being a female doctor. So I thought of taking radiology, pediatrics, or gynecology, or dermatology. Then I thought of pediatrics. Being among with the children, you can rejuvenate or replay your childhood as well. So this is how I took pediatrics. But though I was very much into the interventions, so I thought of to choose another branch for my super specialty. Then I thought of taking NICU as well as I was like very keen for the infants and the newborns. But then again, I thought of should I go for an emergency branch being a female. So I took pediatric gastroenterology so that I can cherish my dream for the intervention procedures as well as my non-emerging branches. So this is the journey how it took me to the pediatric gastroenterology.
Excellent, ma'am. So we generally differentiate between gastroenterology, then pediatric gastroenterology. And while you were answering the first question itself, the thought came in the mind called about neonatology-related gastroenterology. So how the gut health is important for the newborns and neonates?
Yeah, firstly, we should keep this thing very much in our mind that children are not the young adults. So pediatric gastroenterology is an emerging branch which we should be aware of, that why pediatric gastroenterology is important. So this topic which you have asked me as a question is very close to my heart, as if like dealing with early gut issues in infants and especially in NICU setups. is of utmost importance, because if they have not been treated properly, they can lead to or may be associated with lifelong implications or complication. So today I am here to give you an insight which will probably help parents to have a better understanding of this topic for the better compliance and the improvement in their ward's health.
So, ma'am, let us come to infantile colic to begin with. So, how will you define infantile colic? What are the key symptoms of that? And what role parents can play in this? And how the management works?
Yeah, a very nice question you have put up. So basically, infantile colic is a very serious gut-related issues, mostly in the premature children. And it is intestinal inflammatory disorders in which certain part of the intestinal tissues die, which leads to the perforation, and if not treated on time and with the appropriate management, they may lead to lifelong complications. So why this NEC, we usually call it in a short form for neonatal enterocolitis. So what happens? Why children gets this? So basically premature. The major risk factor is the premature children. Secondly, the ones who have been fed with the formula feeds, and one who have the gut dysbiosis. Now, another question comes up, what is gut dysbiosis? Basically, in premature infants who have been either born early to their duration or by the cesarean sections, so they have a lacking of the good or the healthy bacteria in their body or the immune system. So this leads to the outgrow of the unhealthy bacteria. So they have a lower immunity, immune response, and the strength to fight up against the infection and the inflammation. So on the other hand, the one who have been delivered with the vaginal delivery or the normal process, so the vagina has the ample of good bacteria, so which is being transmitted to the child as soon as the birth takes place. So these are the certain risk factors.
When you talk about the abdominal pain or maybe the gut dysbiosis and the recurrence of abdominal pain, so is there a relationship between their poor immunity and recurrent abdominal pain, and for that matter even the recurrent cough and cold as well?
Yeah, definitely. When the child's body or the infant's body is lacking with the good bacteria, so they have a lower immunity as well as their metabolic processes, so they are more susceptible and more prone to the infections, inflammations. So they will be more easily attracted or affected by this normal viral pneumonias, cough and colds, or any small infections in their surroundings. So to prevent this, we should encourage in their childhood or their infancy period to promote or prioritize the breastfeeding, which naturally has some of the immunological factors and the probiotics inbuilt in that. And if the child is like in the NICU setting or underweight or premature and is not getting the breast milk, then the child should be complemented or supplemented with certain probiotics, but this should be under the doctor's consultation and the prescription. Which probiotics? Because in the market there are n number of probiotics floating around with a combination or in the single settings with the multiple things. So should not go with the flow that our neighbor's child is taking this probiotic, so my child will also be benefited with this. So not keeping that in mind, you should go to the doctor, have a proper consultation, which probiotic is good for my child, what should be the duration and how it should be taken. So emphasizing it should be under the doctor's consultation and the prescription.
So, ma'am, is there a relationship between the infantile colic and the continuous cry of the baby?
Yeah. So basically, infantile colic is a condition where the child is having an unconditional, unconsolable, excessive cry in an otherwise healthy individual. Parents come to you with so anxious mind, anxiety, worried that my child is feeding well thriving, gaining weight, everything. But once in a blue moon, child starts crying and cries like anything. and it is unstoppable. So basically, this is infantile colic. Why it happens? It is because the gut of this child is basically immature, and there is underdeveloped gut barriers, which causes the bloating and discomfort in the child. This perhaps is self-limiting, and it is a very usual process in the infants, and it starts with like 4 to 6 weeks of life, and as I mentioned that it is self-limiting. It stops or it recovers by the child gains the age of 3 to 6 months. So for this, what is important as in management is to reassure the parents that the child is having this condition and why it is happening. We should discuss in detail with the parents the line of management and the protocol. Simultaneously, we should encourage the burping pattern, some of the soothing exercises which we can train parents. And certainly, we can prescribe them with the probiotics. In the market, we have a couple of this probiotics like Lactobacillus reuteri and Mycobacterium bifidobacterium, which can be given for at least 21 days or as prescribed by the doctor to the parents.
So, ma'am, as you mentioned in the previous question that the parent should not give something on their own which was helpful for the neighbor's child. So, as our fingerprints are unique, so is our microbial flora. And so if you throw a little light on how unique it is and why it requires customized or very personalized treatment.
Yeah. Firstly, you need to determine that what my child is growing through, because a detailed evaluation of your child gives you a different aspect. If I am having a certain that my child is having, or it is being assessed by the pediatrician that the child is crying or having discomforts because of the infantile colic, then different set of probiotics will act. Like as I mentioned that Lactobacillus reuteri or Bifidobacterium, this will act. But if my child is lactose intolerant, then certain other type of probiotics or prebiotics will have a beneficial role. And if my child is having abdominal pain or is having constipation or diarrhea, then another set of probiotics will help. So choice of antibiotics we should leave on the doctor or the consultant to choose what is beneficial for the child and what is not. And the duration also. Some patients require as per the disease for 2 weeks of the duration, another require maybe 3 weeks of the duration.
Secondly, ma'am, the other aspect which we would like to highlight is NEC, necrotizing enterocolitis. So how do you define that and how often it is found in your office practice?
Yeah. So NEC is a condition of premature infants, and it is a very severe condition in which there is an issue with the gut-related dysbiosis, and in which it is basically NEC, necrotizing enterocolitis, is an inflammatory condition in which certain part of your intestinal tissues die, which leads to perforation, and if not treated well on time, it may lead to certain severe complication which can be life-threatening. So to treat NEC, first is early detection. Whatever you feel like, you should not ignore. If you are having anything unusual in your child, do consult to your doctor. If we found that the child was thriving well, gaining weight earlier prior to the detection of the NEC, first go with the certain set of investigation, and if you'll found that the diagnosis is fine, go with antibiotics, then nil per oral. Keep the child NBM so that we can relax the gut, simultaneously adding the suitable and a set of probiotics which would reduce the inflammation and the susceptibility to gain infection. This can be the line of management in treating a child with NEC.
Okay, and can NEC be life-threatening at times?
Yeah, definitely. It can be life-threatening if not treated well on time, or if we have misdiagnosed NEC. Sometimes when the child is thriving well, gaining weight, feeding well, parents are quite relaxed. And once at the moment child stops feeding, there is feeding intolerance, vomiting, there is abdominal distension, then they rush to the hospital. So this is the time to pick NEC fast. If you lose your diagnosis at that point, then it may lead to perforation of the intestine, and then surgical interventions may be required at that time. So picking up the NEC at appropriate time and with a confirmed diagnosis is the key role to prevent the complications.
For example, a child is diagnosed with NEC and timely the treatment and everything was given. But as it is commonly said, the first few years of your life will decide your rest of the life.
Yeah.
And necrotizing means it must have damaged some of the other tissues in the intestine. So what are the general complications or consequences observed in the latter stage of the life?
Basically, we need to focus that why complications are happening in NEC. So in NEC, your intestinal tissues died, or there is a breakage in your intestine. Why it happens? Because our child is premature. Yeah, there is gut dysbiosis because of that prematurity, and there is undergrowth of the gut barriers. So the infection easily can enter or migrate the child in. So if we'll put a barrier or we'll find an approach so that we can cultivate good bacteria and outgrow the number of negative or the harmful bacteria in the child, so we can attain success in this. So now question comes, how can we attain that? First is by putting the child either if the child is premature, low birth weight, or in the NICU setup, whatever the condition it is always better to use a low category of antibiotics. Secondly, you can prescribe them with the good bacteria that are in the form of probiotics and prebiotics, and encourage or educate the parents about the hygiene, cleanliness to prevent infection, because these children are more susceptible to infections.
But once they are recovered, they can live a normal life.
Yeah, as far as data is concerned, maximum of them detected on time recovers approximately 90% in their lives.
And how much duration it takes?
It depends upon body's response, how the child is responding, but usually NEC recovers within 3 to 4 weeks of time, until and unless the child got severe infection.
Correct. So what are the other complex issues are found in neonatologists related to the gut, gastroenterology?
So there will be the first and the foremost important issues we facing in our day-to-day life is feeding intolerance. Secondly, abdominal distension, excessive cry as in infantile colic, repeated vomiting, refusal to feed, and sometimes vomiting along with diarrhea.
So when it comes to the cyclic vomiting or repeated vomiting, how it is diagnosed and what are the treatments available?
Usually cyclic vomiting is not the term which is being used in infants or in the neonatal newborn period. It is a term which is used after, I guess, 3 to 4 years of age, when there are some psychological changes, psychosomatic disorders are there, and then we can think in that direction of CVS.
Regarding the lactose intolerance, as you said, there is a feeding intolerance. So what are the complications of that and how to manage this particular stuff?
Yeah, first we need to differentiate between what is lactose intolerance and what is cow milk protein allergy, because most of the pediatricians practicing, they always label it as lactose intolerance, whether it could be CMPA or lactose intolerance. So how you will diagnose this thing is the first is the age factor. If a child giving you a mother or the parents is giving you the history, strong history that the child was being fed sometimes or the other on any of the bovine milk, then child develop these kind of symptoms like diarrhea, blood in stool, or refusal to feed, frequent vomitings. Then, and the age factor, like up to 1.5 or 2 years of age, it could be because of the cow milk protein allergy. So always in less than 1.5 years of age, your key diagnosis should be of CMPA. Then in the later stage, we can label it as lactose intolerance. Both of them generally do not have a specific test to diagnose. It is just a clinical entity, though we do a reducing substance test, or sometimes we get the patients, they come with the report in hand, doing the stool cultures or stool routine test. So this has of no importance. Stool culture and stool routine are important in only cases of chronic diarrhea or in a child who are immunocompromised. So keeping this in mind, we should make the diagnosis, because keeping the child lactose free is like a daunting task for the parents. It's not that easy that I'll say keep the child lactose free and parents will be so happy to do that. Keep this thing in mind that if it could be your child, how would you manage a child, keeping the child on lactose free or the bovine free things?
Absolutely. And along with this, for the viewers, I would like to reiterate that the first 6 months of the life, the child should be exclusively breastfeeded.
Yeah, so that he or she should get the good bacteria from the mother's milk, which are immunoprotective and contains a natural pre and the probiotics.
So, have you observed any times if the child is fed with some other milk, as you said, maybe the cow milk or the formula feeds before the 6 months of the age, and that is leading to the intolerance?
Yeah, this is a very common issue we face in our day-to-day life, because many a times, like in the current scenario, females are so reluctant. They usually prefer cesarean sections, and they try to avoid, or due to any of the medical illness, that the mother is not having a good or the ample amount which is sufficient for the child's feed. They are not able to produce this much of milk. So instead of taking this formula feed which is available in the markets, they'll prefer, or they have in their backup or in their mindset, that if we'll give them cow's milk, the child will have a better immunity and he or she will gain weight faster. So that's why they prefer this bovine milk instead of giving them the formula feed. So this should be like a campaigning to make them aware what are the benefits of giving the breast milk to the child as well as to the mother. It will help mother to create a bonding between the child and the mother. Motherhood. Thirdly, to shed the weight which has been gained during your pregnancy period. And many of the medical complications with mother can get off by just breastfeeding the child. So this should be like a part of our education, to educate the mother the benefits of breastfeeding, and to discourage this bovine milk or any other source of top feeding until 6 months of age.
Absolutely. So, thank you very much, ma'am, for highlighting the important topics right from infantile colic to NEC, which is necrotizing enterocolitis, and even the other complications, including lactose intolerance or the cow milk intolerance as well. So, I hope this will be helpful for the viewers to understand, those who have newborns or those who are planning for the babies as well. And thank you very much for your insights.
Thank you. Likewise.